Our next panel will be all about how public health impacts the visual environment. We are very fortunate to have with us today Dr. Amy Hillier, who is Assistant Professor in City and Regional Planning at the University of Pennsylvania School of Design, and Julie Hendricks, Director of Eco Services at Kirksey Architects right here in Houston. Please give them a welcome. They'll be conducting our next panel.
Good. Thanks, Brad.
Amy, you going first?
I am up first on the panel, and I'm
Terrific.
sitting here, so I think that would be good.
Perfect. Well, there you go. And so, go use the clicker. I wish. Yeah. All set?
Yeah, no, Hello. I don't know about you, it's going to take me a little bit of time to come back on the ground after that. It was just unbelievably inspiring. Thank you so much. I want to shift gears a little bit. I think you can understand this is not the most enviable position to be in, to follow that, but I welcome the invitation to come to Houston and to talk about some of the beauty in my life. I'm on the faculty at the University of Pennsylvania, which is right in the middle of Philadelphia. And my walk to school every day, I have about 1.5 miles walk, ends right here. The Fine Arts Library at Penn, built in the 1880s and designed by Frank Furness, a fabulous architect who sadly we've lost a lot of his work in Philadelphia, but much of it remains. And the great Louis Kahn refused to go in the more modern School of Design building and had this as his studio in the apse, which now our city planning students have sort of taken over. And I love going to this building. My office is actually just to the side in a wing, but it was also designed by his firm. And I feel privileged. I feel privileged to be at Penn and to walk by this building every day with that kind of beauty. And also, his father, Frank Furness's father, William Henry Furness, was the minister of my church downtown for 50 years, and Frank also designed that church. So this is what I go to work to see. I walk with my 1 or 2 children, depending on who's ready to go. 5 blocks from our beautiful turn-of-the-century house to the public elementary school. I do not pass a single accessory ad or billboard on that entire journey. There was a brief time when I did, and those were taken down quickly. There's not a single place to buy tobacco on my journey with my child from my house to the public school. There was. Across the street from the elementary school is CVS. I'm sure you got the memo that CVS decided they could still make ends meet without selling tobacco. So no more tobacco sales near. And then I proceed not too far before I get on Penn's campus. And needless to say, there are no billboards hovering over Penn's campus. As of now, there are no billboards on the public schools in Philadelphia. Stay tuned. We're not sure what might happen with that. So I say this all to emphasize how important beauty is to my day-to-day experience and how much I know it enriches my life. That said, I've come to offer a different framework, not one that's competing, but I'd say that's complementary, and that's public health. Thinking about why we do this work, justifying it, putting a dollar value on it because of the toll that lack of sign control has on human health. and not just public health, but thinking about this from an environmental justice perspective. So, respectfully, we've been talking about the economics of aesthetics and business economy. I think it's not at all inconsistent to say, let's turn and talk about the health economics of all of this. So this is the world I live in, not as maybe aesthetically beautiful as some of Barnaby's wonderful visuals, but I'm a public health researcher, and public health has really been driven by this idea that there's individuals who live in families, who live in neighborhoods, who live in communities, who live in larger societies that shape their well-being, that influence their behavior and shape their well-being. And so much of what we've been doing in the public health world, very consistent and actually directly related to a lot of the design work, is to think about how we can design environments so that they can promote healthful behaviors and improve health outcomes. And specifically, this is a little bit tough to see the bottom part, sorry, public health intervention pyramid. And the idea is that you can have a big impact on a small number of people through counseling and education and clinical interventions. The bottom, which I don't think you can even read at all there, it says socioeconomic factors. And while I hope to make some headway or see some headway on the troubling problem of poverty in my lifetime, it's rather daunting. So most of public health says we're not gonna take that on directly, but we do want to, the one up above that, change the context to make individuals' default decisions healthy. And I think that's where the emphasis on the built environment and on policies and on design dovetails really nicely with our work. So in what I do, I teach mapping, GIS mapping. I should have said I teach in the School of Design, but I'm a social worker. And sort of like, how do you go from the School of Social Work to the School of Design? Well, at Penn's campus there, it's just a few buildings away. It was a pretty easy move. I just packed up my box and went down Locust Walk. But I know how to teach geographic information systems, GIS. And so the School of Design had use for me and has fortunately decided to keep me there. I teach GIS, but I also teach a class on built environment and public health. And I'm thrilled. You can imagine how cool it is to invite Mary Tracy to your class. And we screened this space available 2 days ago, and Mark Gobet, I'm so pleased that he came to Penn last spring before he passed, so that I had a chance to meet him. Well, this is one of the exercises we go through, which is probably not what most of you do day to day, but to think about plausible causal pathways. And it's basically just the idea that how does the environment, how does what we do then impact health in terms of the short term and the long term? And I think that there's an awful lot of ways, and I didn't even include promoting business or property values, which arguably somebody could also connect to jobs and healthcare and well-being. But I just stuck to specifically, and there's varying amounts of evidence, and I consider it my contribution to this whole movement is to develop evidence that can support these pathways, so that when you go to your city council or your state or whoever's making the rules, that you've got a published study in your back pocket to say, well, look, this is part of our evidence. I think that on the far side, in terms of long-term health outcomes, I think that the idea of human health, lost quality of life, lost years of life, is a pretty compelling argument, particularly as chronic disease, and I'm looking at a physician from New Hampshire, that as chronic disease is taking a huge toll across income, across the United States. But we could also put a dollar sign on it. And if there's one thing that's going to bankrupt the United States, it's going to be the rising care of health costs. So one could make a sort of human health argument here, and one could take it a little bit further and say, we've improved life and we've brought down health costs. So I think that it's pretty clear path from lack of sign control to increase health costs and decrease in human health. I'm just going to talk about a couple of studies that I've worked on that have made, I'd say, modest contributions to demonstrating those pathways. And I have to just mention first Tony Yancey, who is a brilliant public health disparities researcher at UCLA, who through all sort of unfairness, never a smoker died young from lung cancer about a year ago. And she got me involved in this research. I am deeply grateful. And she and her colleague Jerome Williams, who used to be at the University of Texas at Austin, invited me to bring Philadelphia along and to do a study of the content and the prevalence of outdoor advertising. And so they said, you can do this in Philly, find some low-income neighborhoods, some high-income neighborhoods, some black, some Hispanic, some white, and we hired some students to be part of this. And it was remarkable for me because it was really my first experience going out and doing field work. I had learned, my training had been, somebody else has collected the data, be smart and go get that data and sit at the computer and analyze it and have some great results. But you can't know the content of outdoor advertising, at least not at a specific location. You can know generally that McDonald's is one of the biggest billboard purchasers, but if you want to know where the McDonald's billboards are, you got to go and walk around in the city because it's changing, it's dynamic. So fortunately we had this great group of students from Cheney University, which is just outside Philadelphia, who went out with GPS packs and digital cameras. And I said, there's some things you just won't believe unless you go out and see them firsthand. And seeing this in a poor neighborhood in Philadelphia was one of those. Now, I'm thrilled to say that these 8-sheeters all came down in Philadelphia not too long ago at a rather high price in terms of a settlement between the billboard industry and our law department, but that's not a fight that Mary's given up yet, nor the rest of us who are on her board. But it was also my introduction, not just to the non-accessory signs, but the on-premise signs. And this is where, from an environmental justice and a public health disparities framework, I really take exception, and I get pretty upset. And in Philadelphia, these particularly the tobacco ads outside the tobacco outlets, which can be all different kinds of stores, are just absolutely pervasive. And we found that it was a different. Austin was different from LA, from Philadelphia. Austin had more billboards at that point, and this was not a perfect sample, so we weren't sampling the exact same size areas, but had more billboards. But Philadelphia had tons of these little pesky little ads. And we also looked at, and so we thought about the total sheets versus the individual ads, and it was clear, and this is data that our health department use regularly to show how problematic the accessory signs are in Philadelphia in terms of the content. So if I leave you with nothing else, let me say that what I think the most insidious part of outdoor advertising is the unhelpful messages, is the content. And that's not to say that the structures, the preventing, all the other things, but that this is, and perhaps particularly compelling to a very different audience than those of us who are here. And we went a step further and did some statistical analysis to show that there was significant clustering of ads for unhelpful products around places where kids spent time. And that was controlling to some extent for land use. So it wasn't just that, the school just happens to be on the commercial corridor. And in Philadelphia, that was more likely in low-income neighborhoods and in places where African Americans lived. And in Los Angeles, it was more common around places where Hispanics lived. And we were lucky to have the local media pick up on that and think that you guys have all probably courted your local press, and they know to come looking for you whenever there's anything about sign control. And I just encourage you to find the health reporters as well. It's a whole different framework, it's a whole different audience, and that we have a really fabulous one in Philadelphia named Tanya English, who works for our NPR radio station. The other study I wanted to mention was specifically about accessory ads. I was pretty fired up about, especially well, you can call them bandit signs, we should, the signs in the public right-of-way, and just the plastering of the tobacco ads. And I had a chance through the Center for Disease Control and Prevention, public health money that had come to Philadelphia for tobacco control and for obesity prevention, to do some more field work. Again, there's really no way to know what's on the outside of tobacco outlets unless you go out there. Although I will say, Google Earth and Google Street View offer a fairly decent proxy. It's not as time sensitive, but it at least provides us a point in time measure. And the city gave us some of their federal money to go out, and so we had a survey. And the survey focused on the advertisements on the outside and the inside of tobacco outlets. That was the frame. And it's a survey we're happy to share. We know the group that countertobacco.org at the University of North Carolina has done a lot also with signage. And so we trained our folks, community members, and students to go out and to do this work. So just a quick question. Philadelphia is about 140 square miles, so I know small by Texas standards. It feels pretty big to us up in the Northeast. It's actually, I think there's more people in the city of Philadelphia than the state of New Hampshire, where I grew up, which is sort of an interesting point of reference for a small town girl, me. But 140 square miles, 1.5 million people. I know Houston, you guys pushed us down the list of biggest cities, but we're still pretty big. How many tobacco outlets do you think we need? Well, I shouldn't say how many. How many do you think we have? About 4,500 licensed, and we went out to about 2,800 of those. We went to as many as we could in the time frame that we had. And these are the new billboards. This is where the tobacco industry is targeting ethnic targeting, no question, racial targeting of ads, and they're saturated. So what are these, all these in Philadelphia? Now I know everyone doesn't have quite the same problem. Your states do a little better job of regulating their tobacco outlets. In Philadelphia, they're overwhelmingly corner stores. They're mom and pop, individually owned convenience stores. We have, there's a number of other people who sell tobacco, but it's overwhelmingly, it's the corner stores, which I didn't emphasize here, but the corner stores here, overwhelmingly they're the ones who advertise tobacco on the outside. Unlike chain pharmacies, even when CVS has been selling tobacco, they never advertised. This was a guy who's worked with me for a long time who just was great, Keith, who went and did a lot of this research for us. So let me just show you the results of that. We had a study that was published with the city, and now we just submitted this to the Center for Disease Control's journal. But we looked at the distribution of tobacco outlets. So if these are the new tobacco billboards, where are the tobacco outlets? And this is where there's statistically significant clustering. So the red areas, Center City is a low residential density, but the daytime working population is what really explains why there's so many tobacco outlets. Interestingly, they don't have nearly as many advertisements. But then up in North Philadelphia, South Philadelphia, and West Philadelphia, these red blobs are where, given the distribution of the residential population, there should not be so many of these tobacco outlets. And then the areas that are, you can see the lighter areas where I've drawn the census tract boundaries are all high poverty areas, where poverty is higher than 30%. Now, Mary didn't know Mary inadvertently asked me on the plane yesterday, wouldn't it be interesting to see the health outcomes for those neighborhoods? Now, it's pretty hard to go directly from environmental conditions to health outcomes because there's so many things impacting that. But if you look at the smoking rate in Philadelphia, it definitely corresponds to tobacco outlets. Now, which came first, chicken or the egg? We could argue all day. The tobacco industry would probably say we're just responding to the need, but you see those areas map on pretty nicely. The white dots show where, given the distribution of tobacco outlets, where there's clustering of ads for tobacco on tobacco outlets. I'm going to skip that slide. There's a little bit of good news out of Philadelphia in that we haven't figured out how to get any consensus on a non-accessory sign bill, despite a lot of effort from Mary Tracy and others, and the billboard industry. But we have figured out how to come up with some compromise about an accessory sign. Yeah, it's non-accessory that we have in billboards, but we have on accessory, and so that 20% of the window space is now going to be restricted. That's a content-neutral ban, but we're really looking forward to seeing some of that come down. And so I'd say one thing as a researcher, if you have these kinds of new ordinances going into place, if you can get even a student intern to go out and collect some baseline data before those changes go into effect. So we collected all this data not knowing this was going to go into effect, and we're going to be able to show the change as a result of this, which I think will be pretty compelling. Just want to end by quoting my new colleague, John Hendricks, who spoke this morning. who called on us to be guided by values we want to live by, which I thought was a pretty profound way of framing all of this. And I think that was values. He said, implied that there were human values other than monetary value and real estate properties that we aspire to, that are shaping what we do. And I honor order and beauty and conservation, and there's a reference to the architecture of happiness. I definitely honor those as being relevant. But I think that the other ones, and I think Barnaby's presentation throws these out too, love, justice, and equity, and helping us to shape places that allow everyone to achieve their highest potential is work that we can also do, and that the very important work that all of you are doing can contribute to as well. Thank you.
Figured out? Okay, good. Julie, you all set?
All right.
Want to use the clicker? Left, right. Let's forward back.
Hi, everybody. I'm Julie Hendricks, and I am an architect. So I'm going to be talking about urban design and health, and I want to first of all start off by saying that I am not a physician and I am not an academician. So I'm going to be talking about all these issues in terms that I can understand. So hopefully they'll be pretty clear and straightforward. Specifically, my topic today is about physical exertion, physical exercise in the urban environment. Maybe I'll just use the laptop. So the very first conference of urban planners was in 1908. It was a brand new profession at the beginning of the 20th century. And most of the people who were doing it were architects and landscape architects. And the theme of my talk is kind of how these gentlemen, and of course they were all gentlemen, got us into a big mess at this time. And that as architects, or myself as an architect, that it is partly our responsibility to try to figure out how to get ourselves out of this mess. So here's John Nolan in his office in Cambridge. He was a student of Frederick Law Olmsted, and he did a lot of city plans that worked out to be somewhat famous, for example, the one for St. Petersburg, Florida. At the first conference of urban designers in 1908, they talked about some things that would sound totally familiar, probably at any urban design conference today. They were concerned about blight, congestion, affordable housing. At that time, a lot of people had moved from rural areas into cities and they became very crowded. This is a 1908 image of Rochester, which I was a little surprised by, just the density of people on the sidewalk. And at that time, a lot of people felt that cities were very unhealthy places, that they were sites of, that they were unclean, that they made people sick, that they were dens of vice, and that congestion brought all of these issues. And in fact, one of the biggest issues in terms of cleanliness is that the streets were covered with horse manure. The early planners were not wrong that the cities were unhealthy and that they were too congested. So here's a great graph that's from the Centers for Disease Control, and they have been talking about this issue for many years. When I say the city planners weren't wrong, that's because the things that largely killed people in 1900, on the left-hand side there, were infectious diseases, the kinds of things that you get from being in close contact with people and spreading germs. So they were right. This was important. This was something that needed to be addressed. And I'm skipping forward a few decades here, but basically what the early planners felt is that the answer to this problem was to get rid of so much congestion, to spread people out, to make housing more spread out, to spread out uses. Does anybody recognize what this plan is? Levittown, yeah, you got it. Okay, so one of the first and most famous post-war suburbs. And so prototypical. To us, it looks exactly like the suburbs of today, and in fact, it is very like them. And here are some of the 4 models that you had to choose from when you were going to live in Levittown in 1957. And so the fundamental thing I see when I look at these houses is, what is the principle, what is the guiding value, what is the number one thing that the family that is living in that house is organizing their lives around? Car. Yeah, totally. I mean, if you live in Levittown, you do not have another choice to get from place to place, to go anywhere that you have to go besides hopping in your car and driving out of the garage, which is the central and one of the most important features of the house. And we still have that all over the suburbs of the US, houses just like this. So here's Levittown 15 years beyond the last picture that I showed, and starting to look like suburbs of Houston that we see appearing right now. We see these all over the country, popping up everywhere. And so the interesting thing, the sort of inflammatory thing that I'm going to say, is that if those early city planners, John Nolan and his buddies, had sat down in 1908 and said, we're going to design American cities so that every American in 100 years will be overweight, diabetic, and depressed. If they had said that, they could hardly have done a better job. And so here's the same CDC graph again, and let's look this time at what is killing people today in 2010. So the things that are killing people now are largely chronic illnesses. So you can see there are heart disease and cancer and non-infectious airways diseases. An example is chronic obstructive pulmonary disease. Cerebrovascular disease, an example is arteriosclerosis. So these are all chronic conditions, and they're very related to sedentary lifestyle. Here's a couple of slides that I'm sure you guys have probably seen dozens of times, but they're just so staggering we have to look at them again. So over the last 20 years, we've been experiencing this obesity epidemic. Here is a US map from 1991, so a mere 20 years ago. And every single state had a rate of obesity that was less than 19%. Not that that's so great, but every single state had that. And you can see in the lower left, diabetes, the level of diabetes we had in 91. And then a mere 20 years later, really not that long, a blink of an eye, the obesity rates have skyrocketed. There's now not a single state that has a rate of obesity that's 19%. And many of them have a rate that's over 30%, including ours, including Texas. And in fact, Harris County, where we are right now, has one of the highest obesity rates in the whole country. And type 2 diabetes in the lower left-hand corner has followed suit. Another trend that is happening is that a lot more people are on antidepressants. Could be related to the fact that more people are depressed. That's a little controversial. And here's a graph showing the rise in diabetes over the same period. Or actually not over the same period, over a much longer period. About 50 years, which is the scope that I'll be talking about for most of this presentation. So I've been painting the car as kind of the villain in this story up to now, and it's a villain, but it's not the only one. We have sedentary lifestyles related to a lot of things that we're doing these days. But since I talked about the car, let's start with the car. So one of the things that happened with the way we have laid out cities now is that we have engineered out of our lives almost every single opportunity for physical activity. Incidental physical activity, we'll say, incidental physical activity. So back in 1969, 50% of all kids walked to school every day, uphill in the snow both ways. And I walked to school. How many of you guys walked to school? Almost everybody. 50% at least, I bet. But today, guess how many students walk to school every day today, approximately? 9%, so that was a really good guess, 9%. So that's a huge reduction, and as a lot of you probably know, schools aren't terribly inviting to walk to, many of them these days. They look like penitentiaries. You have to walk half a mile just to get around them. They're surrounded by a giant gate. They're not friendly places to walk to anymore, and you're really not intended to walk to them. This is vehicle miles traveled over the course of the last 50 years, and this is 1950 to 2000, so it stops 14 years ago, just to note that. But it's gone up over threefold over that period, the amount of vehicle miles traveled, time that people spend in the car. And this little graph in the upper right-hand corner sort of explains what's happening there, and a lot of it is related to people's choices of where they live. So you can see from the black bar that people who live in rural areas, that's decreased by about half. People who live in central cities, that's decreased just a little. But of people who have moved to the suburbs, it's a massive move. And again, this is up to 2,000. I'm happy to say that between vehicle miles traveled and people moving to the suburbs, both of those have started to level out over the last 14 years. But then to direct our attention to all those poor people stuck in the traffic jam in the image, it turns out that being stuck in a car is actually not very good for you. It increases your levels of blood sugar, blood pressure, adrenaline, cortisol. Cortisol is a stress hormone, and that it actually takes around an hour and a half for all those levels to go back to normal after you get out of your car. And that in the time when those levels are elevated, you are at greater risk for a heart attack. And in fact, more miles driven does correspond to greater increase in heart attack. Oh, and then here's another good one. And this is really kind of relevant for people who live here in Houston, many of whom commute long distances. That every 87 miles you drive is a 1 in a million lottery ticket for death. So for a lot of people, that's their commute, 40 miles to work, 40 miles back. It's pretty scary. Okay, so that's travel. That's in transit. In transit, we do a lot less that would involve physical exertion. And what about at work? 50 years ago, there were a lot more people who did jobs like this, and this, and this, hard manual labor kinds of jobs, or at least jobs that included more labor in them. And these days, there's been a big switch in the kinds of jobs that people do. So you can see agricultural jobs have decreased quite a bit by more than half. Goods-producing jobs have gone way down. And what have they been replaced with? Mostly service-related jobs. And I'm in a service-related job. I spend an awful lot of time, on average 9 to 10 hours a day, sitting in a chair. And maybe some of you have seen some of the news reports that have come out in the last couple of years, and many of them had the title, "Sitting is the New Smoking." That's how bad for you it is, sitting. Even despite the amount of physical exercise you might get outside of the time you spend sitting, sitting is going to increase your risk of all of those chronic diseases that we had listed up earlier. So sitting is terribly bad for you. And then of course, as this slide implies, a lot of times when you spend a lot of time sitting, you might start making poor nutritional choices as well. So to summarize, back in the 60s, about half of jobs required physical activity. Today, less than 20% do. Okay, and then finally, our choices at home. And this is not choices that we make for recreational activities, but stuff we have to do, chores, you might say. So in my grandparents' lifetime, they did an awful lot of chores at home, and it required a lot of physical exertion. Hanging clothes, chopping wood. Chopping wood was a lot more work than just flipping a switch on your thermostat to get it to be warmer in your house. And these days, the household work that we have to do has been so much simplified. We don't have to work that hard anymore. If anybody here has ever tried to make cream or butter by hand, oh my gosh, how strong you have to be to do that. We don't have that. We don't have that anymore. We don't have to do it. Here's a fun little chart of the amount of calories that you expend doing some typical household tasks. And the recent research has shown that all of the time you spend doing physical activities over the course of the day counts. You don't have to do 30 minutes at a stretch to get credit for it. You spend 15 minutes doing vacuuming, that totally counts. And when you don't spend that 15 minutes, as we so often don't anymore, that hurts you. Okay, and then finally, and I find this to be very instructive and interesting. So the first part, we spend an awful lot of time in front of screens these days. I found this amazing statistic related to TV watching, that every 1 hour of TV watching corresponds to a 22-minute decrease in your lifespan. So that's something we can all think about the next time we're watching an episode of Downton Abbey. And outside of TV, we have a whole bunch more screens to look at now. We have little bitty screens, we have tablet-sized screens. We spend even more time looking at all those screens, and most of that time, again, is sitting, which is so bad. My son does an awful lot of what's shown in this picture. And there's a study that shows that between 2004 and 2009, there was and I couldn't believe this, 49% increase in the time that kids spend playing video games. I would chalk a lot of that up to tablets because it makes it even more easy and convenient and portable to play video games all the time. And this is just kind of a fun chart. This is, again, up to 2000, which is why it has a dated reference in it. But between 1987 and 2000, you can see there was a huge growth in radio and TV stores and a little kind of modest plodding growth in sporting goods and bicycle shops. So that kind of shows where we're going. And if we were going to update it for 2014, we'd have the electronics stores and the phone stores in addition to that, and it would show an even higher peak, no doubt. Okay, so here's the thing that's really interesting, that the amount of time that Americans spend doing activities like this, such as sporting activities, has not gone down over the period in question in the last 50 years. It's actually maybe gone up just a teeny bit, marginally. And I think that's fascinating because what it's telling us is that all of the subtraction in physical exertion has happened between our changing modes of travel, our changing modes of work, and our household activities. Those are the places where we have lost all of our physical exercise. And that's really interesting because it's a clue for us, because what can we now do to get that back into our lives? And that's where we architects come in. Here is a great set of guidelines that was put together by New York City. They have been thinking about this issue for a number of years. I think this may be the 7th year that this active design guidelines have been around. And they have guidelines for both urban design and for building design. I think this is still really the beginning of thinking about this issue, that there's a lot more that we can do, and that the more people are thinking about it, and the more my clients are asking for it, the better we can do. So one of the guidelines, obviously, is related to connecting people in an urban environment. If we can make taking some kind of transportation other than a car easy and desirable, the studies show that people will do it. Surprise? Okay. So here's a movement toward complete streets, and the idea of complete streets is that every kind of transport can move freely and safely on a road, not just cars. Cars, of course, have to be safe and they have to get where they're going effectively, but also pedestrians have to feel safe. If you don't feel safe, you will not walk, and that's true of a lot of older people. They may not be able to drive, and yet they don't want to walk because it's dangerous. People bicycling, you want them to feel safe as well. And then finally, the street should be designed to accommodate public transportation. When all those modes are working together, then we have a complete street, and we have a street that people might take to get from place to place. Without that, then you understand people's decision never to walk anywhere. Here's a street in Copenhagen. They have a great network for bicyclists, which encourages lots of people to bike. It's a positive feedback cycle. Have any of you seen those spray-painted white bikes that we have all around the city here? The ghost bikes? I think those are incredibly powerful. What a great marketing message those are. I mean a moving marketing message is what I mean. I have a friend who works in my office, and his house is just 10 minutes by bicycle from the office. And we ask him, why don't you bicycle to work? You could totally do that. It would be easy. And he says, because I choose life. And there's literally on that 10-minute route a ghost bike sitting right there to remind us every day that some poor bicyclist died on that route that he does not want to take. So I understand his decision. This is something that policymakers can help change. So here's an attractive pedestrian environment that we'd like to create. It makes people want to walk. Wouldn't it be great to want to get to one place to another by walking? So you can see we have places for pedestrians to sit. We have shade. That's incredibly important to trying to create some thermal comfort. We have places for a bicycle to be stored, and we have lots of engaging dynamic things going on the street for people to get involved with. This is an image of Telephone Road in Houston. There's this great program called Build a Better Block, where you can envision a road that is not at all effective as a complete street right now, and make it into, for a day, a street that could be effective for all modes of transportation. So this was done last fall in Houston. They made a bike lane. They made lots of activities on the street for pedestrians to get involved with. And I think it turned out to be great, and an interesting thing that maybe has partially come of that is that we now have a complete streets ordinance in Houston. Scenic Houston, among other folks, advocated for that wonderful new thing. And what it means is that new streets and renovated streets are going to have to consider all modes of transportation in street redesign, and that's a wonderful thing. And now just really quick about building design. In building design, what we need to do is to encourage people to get up as much as possible. Really, even just standing up from your sitting position that you're in 10 hours a day helps a lot. If you can get somebody to stand up and walk somewhere at least once an hour, that little move makes a really big difference in their health. So one of the key things is that we can try to make stairs a lot more inviting and attractive. You shouldn't be hiding stairs off to the side. They should be right in the middle of a building. They should be incredibly inviting. You should look at them and think, oh my God, I wish I knew what was at the top of those stairs. That's how you should feel about stairs. And that's something architects can do and that we need to change and start doing more. And then the elevators should be the thing that it's like, where is that again? I'm not even sure where that elevator is. And we can do the same thing with walkways. Any place that is connecting two areas of a building where people have to go, wouldn't it be great for us to make it beautifully daylit, very visually interesting, and very attractive so that you want to make that walk often? So those are just the basics. As I said, I think this is just at the very beginning. I hope that all of you guys who may be clients who have architectural projects will think to talk to your architects about this issue. It's so important for all of us. And that's it. Thank you.